Well, hello everybody. It's Dr. Carmen Bryant, and this is Car Chronicles. How you guys doing? Good to see you guys. Well, I can't see you, but you can see me, but it's the concept. Hey everybody, how are you guys doing? You guys ready? Let's do it. So I know many of you guys are looking at these narcissists, and it's really mind-boggling because here you have this person that's so full of turmoil and trauma and chaos, and you're wondering, why can't you just love me? Why can't you just be right? Well, you have to think, how can a person that is full of chaos and trauma and pain and hurt, how can they give you anything but what is inside of them? They're manifesting whatever is inside of them. If you look at a hoarder in the home that they live in is a manifestation of what's going on the inside of them. And so exactly the same thing with a narcissist, that trauma, that chaos, that confusion, the way that they talk to you, that's all that's on the inside of them. Why do you think they project all the time? Why do you think they divert conversations? You can't even have a conversation. The more you talk to them, the more you start thinking there's something wrong with you. And it's really them, and it's manifesting outside of them. So how can someone give you peace when they have nothing but turmoil on the inside of them? And a lot of you look at them and you're assuming to yourself, because of the things that you read, is that this person has multiple personality disorder, or what's now known as dissociative identity disorder. And a lot of you are wondering, that you can't tell me any different because I've seen them jump from personality to personality. But let me educate you just a little bit, okay? Even in a mental health, in office, when you're dealing with these narcissists, don't you know that a lot of therapists, it's not that we're confused, but it takes a lot of focus, and sometimes we have to go back to our books to look and see what is happening right now, what is going on, because you have narcissists that come in that are they are off the chain. And the thing about it is when I started researching in research paper, and I meant to state where I got the research from. Please forgive me. I don't mean to give you information and not give you something to go back and look on. But if you go and look at research journals and articles, a lot of them say that it's highly unlikely that a person that has narcissistic personality disorder also has dissociative identity disorder. Highly unlikely, because of the fact that now both of them, because multiple personalities, which you guys used to know it as, is dissociative identity disorder and narcissistic personality disorder, both of them derive from trauma, some type of trauma, especially DID, that derives from something traumatic happening in childhood. And narcissistic personality disorder, although a lot of them do deal with psychological trauma, neglect, rejection, abandonment, parenting. A lot of them may not have been physically violated, but even in the parenting, the way, that is traumatic. That is abusive. When they were growing up, they were taught not to have empathy. They were taught these things. But DID comes from trauma. And what happens with a person that has multiple personalities, we'll just use that term because some people are not familiar with dissociative identity disorder. And those of you that are, you know what I'm talking about. But there is an inception date of the personality or that entity. So what happens is the true identity of the person that has multiple personality disorder is usually where that person has been traumatized. It could have been 2 years old, 3 years old, 4 years old. And so the true identity, the true personality of the person may be a 2-3-year-old. And from that point forward, where they are traumatized, they dissociate, and a whole new identity, there's an inception date or a birth date of that whole new identity. And that identity can be male, female, lesbian, homosexual, whatever. But it creates, there is a whole personality that creates itself. There's an inception date or a birth date of a whole new personality that helps them to survive. And it could be up to 100 different personalities or more. Different personalities that helps them to function throughout the day. Anytime that personality or that entity takes over, the other entities don't often know that entity is there, that personality is there. Now, let's switch over to a narcissist. A narcissist is like walking through a hall of mirrors, and they see all these different people in these hall of mirrors because they are mirroring different people. They play a role with the different people, and they do it consciously. They play different roles for different people that they meet. They're in the sports arena. All of a sudden, they are sports fanatics or a former NFL star. They're around a legal or a judicial system. Now all of a sudden they are, a part of the legal system. They get around people in the medical field. Now they have the terminology and the personality of those that are in the medical field. Dentistry, counselors, therapists. They don't come into therapy to get healed. They come into therapy to draw so they can build onto another identity that they're going to play. However, the mask does fall off because sometimes they can't recall what role that they played, but they have a true identity, but they don't, because they feel weak, they have a very low self-esteem. That is their true identity. Low self-esteem, low self-worth. They have no sense of self-esteem, so that is their true nature. But they don't want anybody to see their true nature, and so they come up with these different identities. And these identities, they're very aware of the identities because they know what role that they have to play. As opposed to a person that has multiple personality disorders, they don't know when each personality takes over, when each entity takes over, right? Here's another. So let's talk about circumstantial and tangential speech or thought. Circumstantial speech or thought, circumstantial thought. Circumstantial thought is an indicator of a person that has a thought disorder, or they go off a topic. They go so far off topic. They talk about things that are really irrelevant to the topic at hand. And so they put all this information in and they talk in circles and circles and circles and circles before they get back to the main topic. Circumstantial thought and speech, you hear them as they're speaking so you know how they're thinking. They add irrelevant information in their conversation, unnecessary information in their conversation. And I'm getting somewhere with this. Tangential speech is when they start going off on a tangent. They get so far away from the topic, they're talking about things that is totally irrelevant to the conversation that you were having. Apples and oranges, football and baseball, two totally different things. Tangential, meaning on a tangent. They go on a tangent, and a lot of times you see that with people that have ADHD or bipolar disorder as well. But they go on a tangent. They get so far away from the topic that they don't want to talk about the topic, or they just get so far away from the topic that has absolutely nothing to do with what they're talking about. Nothing to do with what you're talking about. So they're on a tangent. It's like they lose their total train of thought, and it has absolutely nothing to do with what you're saying. Correct? And to go back to circumstantial is all this excessive information and extra information or excessive details that is really irrelevant to what you're talking about. Now, let's talk about that for a minute. So you have a narcissist that's already not comfortable in their own skin, so they create their own personas. They're very aware of the personas that they create. Now, true enough, the mask will fall off from time to time because they forget what role that they're playing, but they know that they're playing a role. So they have to dress the part, they have to do certain things, so they know what they're doing. A person that has multiple personality disorders, they don't know when that personality takes over. It's big blanks in their minds where they cannot recall the things that they have done. They don't know what was said because the true identity of them is a 2 or 3 year old, whatever it is. And then here they have an inception date. Remember, personality has an inception date where it is born to protect and to function. And so it could be different ages. It can be from the age of toddlers, teenagers, adults, old people, business people, whatever. But they do not know when they're switching to these different personalities. A person that has narcissistic personality disorder knows that they're playing these roles. They're playing these, and whenever a narcissist is confronted or you're having conversations, if you do not agree with them, or if they cannot convince you, that's a part of the manipulation process. They're going to manipulate you. So sometimes you see them, they do have thought disorders. Some of them do have thought disorders where they switch from topic to topic. They're tangential, go on a tangent, or they're circumstantial, talking in circles. And a lot of times that also plays a role in the manipulation. So when we talk about the gaslighting, and we talk about when you're talking to them, you're totally getting lost because they're gaslighting you. They're making you feel like you're crazy. You're walking on eggshells. It's that word game, that word, the word play, the word salads. Now, word salad actually derives from people that have schizophrenia, which it makes no sense. But we use this in the idea of a narcissist with this word salad. They play these games. So here you can implement the tangential and circumstantial speech because they're trying to get you away from the topic. Especially if you're hitting on something, they get you away from these topics. They talk in circles. They talk. So all this is a part of the narcissist. So imagine how confusing it can be in therapy when you're trying to focus on this individual and you're trying to take notes. So just imagine how much more confusing it is for you when you really don't know exactly what is happening. These are those narcissists. They make you feel crazy.